We appreciate the opportunity to be together again with you today on our regular Friday updates that we've reinstituted here as the fall has worn on and the winter is upon us. Just wanting to keep you, our staff, our families, residents, and just those who are supporting and encouraging Wellspring to just be informed and sort of know what's going on. And so we always look forward to these opportunities. And as I reported last week, the pattern that we're seeing, particularly in our senior services division, really remains the same these last several weeks as the spike of COVID has been occurring in our communities. And that pattern is simply that we're seeing cases popping up here and there, one, two, maybe three in a building in a period of time. And so not the sort of large outbreaks that we've seen in other places that we've experienced even this past spring a little bit. And so we're grateful for that. And one of the reasons that we think we're experiencing it that way now is because of testing and the protocols we've put in place. We've referenced that in previous conversations. And so I wanted to bring Sean DeFore into this conversation to have you, Sean, talk a little bit about what those protocols are and how they're working and why they matter.
Yeah, thanks, Dave. And just to underscore the comment you made, and we mentioned this in previous videos, but the availability of testing has really been a game changer for us to help control spread within our facilities and even in the community as, 1 and 2 cases pop up. Largely, they're remaining pretty isolated in most of our spaces. And that's because we have a protocol where on a weekly basis right now, we are testing all residents. Twice a week, we test all of our staff. If a positive comes up, then we're testing everybody in our buildings, staff and residents, twice a week until we have at least 2 weeks in a row where we have 0 positives popping up at all. On top of that, we have rapid testing where we can get a result within 15 minutes. And if we have a staff member or a resident who shows any symptoms in any of our facilities, we're able to do that rapid test. And if it does prove positive, then we're able to move that person off work or isolate that resident and then do contact tracing and additional testing on top of what we're already doing. So the testing has really been a significant advantage for us that we're using effectively.
Yeah, that's great. And of course, and you've pointed this out, we've talked about it before, the fact that wasn't available early in this pandemic really put us at a disadvantage, and now it has advantaged us in this fight. We're solid in our PPE inventory, always sort of building that inventory for the future as well. But we feel like we're in a good place, and we don't take that for granted. And the protocols for infection control, the training, the education, the oversight goes on with sort of tenacious focus, but that's been a big part of making this work thus far. We know we're in it for long haul. Certainly, all the experts we follow and focus on are in agreement that we're in for a continued spike throughout the holidays. And with Thanksgiving done now, Christmas looming, we know that folks will get together. We really would encourage all of us to do our best to limit the spread by limiting our contact and doing all the safety protocols that are now ingrained in our heads. But we need to put them into practice, and it's so tempting at Christmas to get lax and want to get the big family gathering, and we just need to sort of stay in this and stay focused on the right things to do here to get through this, because the sooner we do, the sooner our residents get to see their loved ones again, which is our goal at this point. It's our singular goal, is to prevent infection and to get our folks back together. So with that said, I'm going to shift a little bit here, Sean. And while all of this has been going on, we talk a lot about our senior services on these videos, but we have a large and growing, in fact, child and family welfare division that is doing some outstanding work, and even in the midst of the pandemic has been expanding. And we picked up some new services, some new contracts this fall that it will probably be fun to just update on, so folks understand the kind of work we're doing in that division.
Yeah, absolutely. And we think we shared back in June, perhaps, when we did our last video some time ago, that Wellspring had been awarded a number of contracts to provide a new expanded service in the state called foster care supportive visitation, where we have expert staff that act as coaches during visits that parents with their children in foster care have with their kids, to help strengthen parenting and bonding and just sort of coach parents through that process. So we have 9 new programs that we opened October 1st successfully that have been going very well since we started, and added, I think, 2 new counties to Wellspring's already. I think we were serving 52 counties at the time. So sort of expanded our presence there, including up north. We have a new office in Marquette and a new office in Jackson that we just opened. Also, we were excited to bring online our new residential unit that's focused on youth in the child welfare system that need residential care, that have sensory needs. A pretty special program, particularly for kids on the autism spectrum, and we're excited to be serving some of those youth now. That program opened officially October 1st as well. And we've continued to expand and grow our behavioral health, which we're finding is needed more now than I think many of us anticipated or saw before, both in increases in substance use. And we have a number of programs that address that issue, as well as just general psychosocial and parenting issues across the state. So our work in that area has grown as well. Exciting to be able to fill the need.
Yeah, it is sort of unique and certainly a blessing that we've been able to continue to not just serve, but to expand those services at a time where our communities are really hurting. And so I'm really proud of the work Wellspring's doing. I'm proud of you and your teams, who just have not just persevered, but have done so with excellence and really with that eye on our mission all the time. And so we're very blessed as we do that. And so in closing, I just want to sort of make an appeal again for you all who may be watching this, supporting us, praying for us, encouraging us to consider getting involved in our program this Christmas called Christmas at Home, which is our way of saying thank you and encouraging our frontline staff, particularly in our senior services division, that have been really on the front lines in an intense kind of way for now 9 months, and really no end in sight, not in the short term anyways. And so Christmas at Home is intended for supporters like you to consider giving a gift of $50 that would provide a meal for one of our workers and their families at Christmas. The nice thing about this program is that $50 will be spent on local family-owned small restaurant type businesses that will provide that meal. And so not only are we supporting our staff who really could use a thank you and a family meal, but we're also supporting our local economy and restaurateurs who are struggling this Christmas. So we would just ask that you might reconsider that. Maybe you heard us talk about it before and meant to get to it, but you haven't. We've had a really great response, but there's a lot of staff and a lot of need. And so we would just ask you to maybe click on that GoFundMe link that's in this post and consider doing what you can for us. Any support would be appreciated. So with that said, we would wish you a blessed day and just encourage you to keep those prayers coming. And that encouragement is vitally important to us as we go through these days. So thank you and God bless.